Hey everyone! Today we're going to talk more about sleep and I'm going to give you my number one tip for chronic insomnia, so stick around. Welcome back. Dr. Ashley here, and I know I've done several videos on sleep before, but sleep is so important to our overall health and well-being and our quality of life. And that's why it's such a big topic that I like to bring up and make sure that you have all the tools necessary so that you are getting good quality, adequate amounts of sleep. So today we're going to go through a little bit of the physiology. I promise it won't be too boring, of how sleep occurs and how sleep is set up in our body. And I'm going to give you my number one tip for if you do find yourself in this pattern of chronic insomnia. And it's unlikely to be anything that you have heard before. Along the way, I'm going to sprinkle in some free tips here and there, those you probably or might have heard of, but I want you to understand why we recommend them. And that really does come down to the physiology of your body, of your brain, and why setting yourself up doing these things sets yourself up for success. Okay, so stick around. We're going to talk about all things sleep. All right. Before we get going into more of the biology and physiology, I wanted to let you know why I feel so passionate about this topic and why I feel like an expert in this topic. Not only do we get lots of training in medical school and especially with family medicine, that is one of the primary complaints that we see is difficulty sleeping. And a lot of people really don't like the kind of current traditional way of treating sleep, which is just giving you a pill to make you fall asleep. We all know that those pills usually result in kind of this groggy, hungover feeling the next morning. It doesn't translate into our normal kind of patterns of sleep. And a lot of people are driven to go a more natural or more integrative route. So I have a lot of training from my fellowship training in integrative medicine on sleep and ways to help people sleep. So my medicine background gives me tons of information, but on a more personal note, I just wanted to let you know my sleep journey. I used to be an excellent sleeper. I had no problem sleeping. During medical training, including medical school and residency, you work on a monthly cycle. So you do one rotation per month and then you switch over on the next month. Without a doubt, I would sleep like crap the night before a rotation would start. And that was just anxiety and fear. And then the next day, that nervousness quelled, and I was so exhausted usually that I was right back on track. So once a month, I would have a sleepless night and then I was fine. Totally manageable, totally livable. I was an excellent sleeper. And then I got pregnant with my son. And starting in the second trimester, I developed horrible restless legs. If you've never experienced restless legs, it is the worst sensation ever. It is this discomfort of your legs just needing to move. It's not painful, but it occurs right as you're about to fall asleep. And so it's like as soon as you start to doze off, like somebody's poking and prodding you to start moving. And that lasted throughout my entire pregnancy, the second and third trimesters, compounded with just the discomfort, the pain of the third trimester, having to get up all the time to pee. So I was sleeping like crap for months before my son was born. The night that my son was born, my restless legs went away, but then of course I had a new issue, and that was having a newborn. And we really struggled with sleep and nursing for about the first 6 or 7 months of his life before we got it together. So in culmination, that was about a year of my life that I just had something that was preventing me from sleeping well. That's okay. Those things all got corrected. The problem came with my brain started getting set up with these expectations and these thoughts of I'm never going to sleep again. And that translated into, even when I was feeling well, even when my son was sleeping, I was not sleeping. I would be up in the middle of the night for hours. I turned into this horrible insomnia that I struggled with for probably the first 18 months of his life, so an additional year after his sleep got improved. So that sucked. I remember being up in the middle of the night thinking, I have this great life and I love my family, I love my work, And sleep is preventing me from enjoying my life, of actually living my life, because I'm so exhausted, and it's causing me like significant depression. It was just a horrible, horrible cycle. So I not only fell back on the knowledge that I had learned through medical training and integrative medicine training, but I was pushed to do even more research, to really dig down and figure out the best strategies for overcoming this chronic insomnia. Let me tell you right now, knock on wood, I am doing great. So that is why I know what it's like to not sleep well. And I have so many tricks up my sleeves for getting you to sleep better. So that's what makes me an expert on this topic. Okay, so let's do some very, very basic sleep physiology 101. We're not going to get too complicated here, but I want you to understand how sleep occurs in the body. So first, we're going to start with the hypothalamus. The hypothalamus is a part of your brain that kind of sits in the very center of your brain, and it is responsible for homeostasis. It kind of regulates everything within the body. It takes in signals from your body as well as the external environment to keep you in balance. So as you can see on this diagram, the hypothalamus is responsible for so many systems. This is just a couple of them. This isn't everything that it's responsible for. But I wanted to kind of draw how sleep is related to other pieces of your overall physiology and your waking being. So again, it receives information from both your internal environment and your external environment. So for instance, your stomach will give you signals that you're hungry, and the hypothalamus gets that signal and says, okay, let's go eat. It drives you to eat. It adjusts all of your hormones based on what's going on in the body. So it adjusts your thyroid hormone. When it feels like something's happening and you're under a little bit more stress, it's going to adjust your cortisol hormone as well. It also helps regulate your nervous system, your autonomic nervous system. So that is going to be the balance between your sympathetic nervous system, the fight or flight response, as well as your parasympathetic nervous system, the rest and digest. As you can see here, it also helps regulate your circadian rhythm. There are multiple factors involved in that circadian rhythm that your hypothalamus coordinates to ensure that you're asleep and recovering, resting and recovering when you need to be, and that you're up and awake and alert when you need to be. As you can see, everything is related. So if your hormones are off, or if your sleep is off, that's going to translate into emotional dysregulation. So that's why you get irritable and grumpy. It also throws off your appetite. So that is the relationship between, that's one of the relationships between poor sleep and weight gain, is that you can't regulate your appetite adequately because your body is putting more focus on trying to get you to sleep. So there are two important things that I want to point out here. First is that your hypothalamus is responsible for threat assessment. Again, it's getting information from your body like, oh, we have an injury, or oh, we have an illness and we need to divert resources to fixing those things, as well as your external environment. Like, oh, a bear is attacking us, let's get ready to run. The hypothalamus does not differentiate between actual threats and perceived threats. Okay? What I mean by that is that it doesn't understand the difference between a bear is actually coming at us, about to attack us, and I'm worried about something happening at a work presentation that I have to give tomorrow. It sees those as both real threats, and it activates your stress response the same way. It doesn't understand the difference, okay? And that is so important when it comes to just overall stress management, but really when it comes to sleep, because your body, your hypothalamus is going to say, no, we're freaking out about something. We can't be resting. We can't be turning on our sleep hormones. We have to be preparing for battle, essentially, even though it's just a perceived worry. So that's the first thing that you need to know. The second is that with all of this, your hypothalamus, your body, your brain really loves routine. It loves to eat at the same time. It loves to wake up at the same time. It loves to turn your cortisol on in the morning and let it slowly drift off in the evening. And that is my first tip, is that all of these different life things that you do that are related to the hypothalamus, you want to do at roughly a regular time. Your hypothalamus doesn't really understand what's going on if you're eating at different times and you're going to bed at different times and you're exercising at different times, because it does require those stress hormones when you exercise. So you want to exercise, but you want to do it at roughly the same time, and that will set you up for success. So that's my first free tip for you. Okay, the second physiology piece that I wanted to touch on is melatonin, of course. We've talked about it in the sleep hygiene video. You've heard about melatonin. A lot of people don't like taking a melatonin supplement because they're worried that it's going to drive down their own production of melatonin. I have lots of thoughts on that. First, melatonin is dosed way too high in this country. You need a whiff of it to just help support your body to produce it at like an actual physiological level. So with that, if you are going to use a melatonin supplement, we're talking at doses of 0.5 to 1 milligrams. Maybe if you're a little bit older, your body's natural melatonin production goes down, so you can go up to 3 milligrams, but we don't need 5, 10, 20 milligram doses. That's just way too high. But if you would still like to avoid melatonin supplementation and encourage your body to produce its own melatonin, the best way to do that is through manipulating the two kind of external factors that cause your pineal gland to secrete melatonin. And again, your pineal gland is controlled from the hypothalamus. So make sure your hypothalamus is in order, and then also control these two environmental factors. Number one is light. Light, especially bright light, blue light, will turn off your melatonin production. So you want good, adequate, bright amounts of light during the day so that your melatonin production goes down. You don't want to be wasting melatonin being produced during the day. You want to store up everything so that you use it at night. And then as you start to wind down at night, if you can't get natural kind of sunset light, then what you want to do is mimic that within your house. So start turning down the lights. Use blue light blockers, and that will help your body start to ramp up melatonin production for sleep. The other big thing is temperature. So being awake during the day, kind of moving around, being out in the sun will naturally warm up your body. And that's one thing that will also drive down melatonin production. Something that turns up melatonin production is cooler temperatures. It just is a signal from your external environment telling your body, okay, it's nighttime. Now it's time to start to fall asleep. So those are two factors. Those are tips 2 and 3 for how you can help get that such important sleep hormone in a more regulated pattern for better sleep. All right, so we've mentioned a lot of hormones that are involved in your sleep-wake patterns. That includes melatonin, cortisol, thyroid hormone, even your sex hormones are involved in this pattern. My final free tip for you is that you don't want to be doing things that disrupt the natural 24-hour cycle. So if you are somebody who really struggles with sleeping consistently on a regular basis, one of the worst things that you could do is nap during the day. Melatonin is building up, and if you nap during the day, those levels drop. And they may not build up enough to reach an adequate level to put you to sleep at night. That, among many other hormonal changes that occur when your body is in sleep versus when your body is awake. So if you don't sleep well, you got to nix napping until you have your sleep on lockdown, until you have those patterns down really well in your brain. All right, so that's the basis for Sleep Physiology 101. I hope you understand a little bit more about all of the processes and parts of your body that are involved in sleep. Now it is time for my number one tip for chronic insomnia. So if you are somebody who struggles with sleep on a regular basis, my number one tip for you is to spend less time in bed. And you may not have heard that before, but it's so important. I do have patients all the time telling me I am spending 10 hours in bed trying to get enough sleep, but I'm only sleeping for 6 hours and I feel like crap and my sleep is not improving. So what that is doing is that is letting your brain know or associate being in bed with being awake. And that's exactly the opposite thing that you want when you struggle with chronic insomnia. You don't want your brain to think that it's okay to be awake while it's in bed. So my number one tip for you is really to restrict how much time you are spending in bed. Start with whatever your goal sleep time is. So if you know that you function well on 7 hours, just give yourself 7 hours to sleep, or give yourself 7 hours in bed to sleep. If you do a little bit better on 8, give yourself 8 hours, but don't go for those like extra long periods of 8, 9, 10, 11, 12 hours in bed that you're just trying to fall asleep, because that is just setting your brain up for failure. Spending less time in bed is also the basis for 2 techniques that are used in cognitive behavioral therapy for insomnia. So this is actually the number one treatment for chronic insomnia, CBTI. And it includes both stimulus control therapy as well as sleep restriction therapy. And those are complicated. It's beyond the scope of this talk to explain what those are. But one of the base factors for both of those is that really we're trying to get your brain associated with bed is sleep, bed is sleep. And so limiting the amount of time that you're spending in bed awake is one of the biggest factors in both of those trainings. So if you struggle for chronic insomnia, spend less time in bed. So I hope that was really helpful for you to learn and to hear, and hopefully you can take some of those tips and start implementing them into your nighttime routine and hopefully get some improved sleep. If it's okay with you, I would like to tell you about a new program that I've been working on and that I'm really excited about, and it's all geared towards sleep. So this program is called the Sleep Solution, and I have really brought in all of those things that I have learned through all of my training, both traditional medicine as well as integrative medicine, as well as all of the things that I have gone out and sought and learned on my own, into one comprehensive program to help people who struggle with chronic insomnia. So meaning sleeplessness that lasts longer than 6 weeks, either trouble falling asleep, trouble staying asleep, waking up too early, or a combination of those 3 things. So if that sounds like you, this may be a wonderful program for you to check out. So I wanted to just go through what all is involved in the program so that you get an idea of what is included. The first kind of phase or section is combined of 3 things. The first one is really getting sleep hygiene down, making sure that your brain and body understand the patterns of when we're awake and when we're asleep. We combine that with specific relaxation techniques. So whatever speaks the most to you, I give you lots of options, and I give you guided audio tapes to listen to me kind of at night or practice them throughout the day whenever you're feeling stressed, because we're really trying to lower that overall sympathetic activation. And then also with the use of essential oils. And it's so fascinating because essential oils have lots of different properties. So whether you struggle with anxiety or pain or just nervousness or anything like that, the olfactory system, so your nose, your smeller, is still working throughout night. So it is a wonderful thing to be able to implement all at the same time. So after you get those 3 things down, if you're still struggling with sleep, then you move on to phase 2. Phase 2 is stimulus control, again, where we're trying to train your brain to be asleep at nighttime in bed, is what we're going for. We combine that with thought work. So as I mentioned, your hypothalamus cannot differentiate between a bear attacking you and the idea of a coworker giving you negative feedback, possibly in the future. It doesn't understand the true physical threat to your being and the perceived, imagined, possible threat in the future. So that's really where this thought work comes into play. Really analyzing what you're thinking and feeling and deciding what to do, if you want to continue thinking and feeling that way, if you want to change thinking and feeling that way, to ultimately make your life better, but really to get your sleep better. We're focused on sleep in this program, obviously. And then at that point, we also introduce some of my favorite supplements for sleep. And yes, melatonin is listed, of course, but I have so many great options and I give you several recommendations for some combination products that I really like as well. Because with a lot of supplements, the way they have been used for thousands of years in more traditional medical systems is in combination. So I give you that information as well. And then after you've gone through that phase, if you're still struggling with sleep, then we move you on to the most intensive piece of therapy, which is sleep restriction therapy. And that's where we're really limiting the amount of time that we give your brain to sleep to further say, no, you have to sleep at this time and in this place. It's the most intensive. My hope is that you won't have to get there, but you have that piece available for you if you need it. I am so excited about this program. I think it has the potential to help so many people. As I mentioned, it has a combination of the cognitive behavioral therapy for insomnia. It has kind of our traditional sleep hygiene piece, but it also has all of these more natural integrative products. So no matter what is going on with you and your specific situation, I think there is something in this for you to learn if you struggle with chronic sleep issues. So I will be releasing it at the end of the month over Labor Day weekend. My plan is to release it at a very discounted price. There is so much information here, but I want to give it to you and get it in as many hands as possible to help as many people as possible. If you want to be the first to find out when it's available, want first access, make sure to sign up for my email list. You can go to selfhealingdrashley.com to do that. And then finally, I have one request of you. I make videos based on the topics that I see my patients struggling the most with. But if there is something that you really want to hear about, want to learn about, want me to talk about, please leave a comment on what you want to hear for one of these future videos. Thanks, guys. We'll see you next time.